Welcome to Curious Conversations. Our special guest today is Dr. Bao Nguyen. Hi, Dr. Nguyen. How are you doing today?
I'm doing well. Thank you for having me today. How are you doing?
Absolutely, I'm doing great. So,
Mhm.
Dr. Nguyen, before we jump into your research, could you tell me a little bit about your background?
So I was born in Vietnam and I went to Huế University of Medicine and Pharmacy for my MD degree. I graduated in 2020, and after my graduation, I went to the United States to pursue my neurology residency training in the US. In order to get familiar with the US healthcare system, I decided to do a clinical rotations specifically in neurology. And during my rotation with Dr. Alaimo, who is the co-author with me in the case report that we're gonna talk about, I saw this case and I decided to write a report about it.
Wow, that's awesome. So, speaking of your case report, can you take us through the new case report that you published in Cureus?
So this is the case report with of me is list of authors, including me and Dr. Darrick Alaimo. The name of the case report is Glossopharyngeal Neuralgia Secondary to COVID-19. So we found during my rotation with Dr. Alaimo, I saw a 54 years old Caucasian man presented to the office with left ear pain and pharynx whenever he swallowed. And he had the symptoms right at the time he had COVID-19. But even after his COVID-19 went away, he still had those symptoms. And his pain was sharp and shooting, mostly at the left tonsil, radiated to the pharynx area, and then ended up inside his left ear canal. So his episode happened a lot. His pain happened episodically throughout the day, lasts for 1 second, and then it lasts only for 1 second. And the pain is like 10 out of 10. It was 10 being the worst pain of life. And it's very typical for a glossopharyngeal neuralgia. And he have the dentist checkup. He has the dental checkup and ENT checkup. And the ENT thought that he might have glossopharyngeal neuralgia and ordered an MRI of the neck, the soft tissues of the neck with a contrast. We didn't see anything from the MRI. He went to the office and we did a thorough physical and neurological examinations, and we didn't find anything. So because of the pain he had was very typical for glossopharyngeal neuralgia, we came to a conclusion that he might have GBN. I would call glossopharyngeal neuralgia as GBN. He might have GBN secondary to COVID-19. We offer him the first line medications for GBN, but he was quite skeptical to take medications so that we schedule him 3 month follow-up. And surprisingly, after when he came back to the office, he didn't actually take any medications, but his pain just went away. So in a literature review, we propose two teaching points from the case report. The first is that the first point we want to talk about is that maybe COVID-19 related to um, GPN, because we know that SARS-CoV-2 left the nervous system, and a lot of patients that have lots of smell, which is the symptoms of the first cranial dysfunctions. So might be the SARS-CoV-2 also attack the ninth cranial nerve as well. And the second point we want to talk about is that if the GPN truly secondary to COVID-19, that pain might be temporary. So it's very crucial for physicians to to give to give that prognosis to the patients because the pain in glossopharyngeal neuralgia is very cruciating. So patient might in the midst of not knowing how the future gonna go. So I think it's very important to give them that good prognosis.
Yes, absolutely. And this is a fascinating case report. So let's take
Thank
a
you.
step back. Could you give us more details on what exactly GPN or glossopharyngeal neuralgia is?
Sure. So excuse me. So glossopharyngeal neuralgia, we are gonna explain two word, which is like glossopharyngeal and neuralgia. So glossopharyngeal is actually it stands for glossopharyngeal nerve, which is the ninth cranial nerve running from starting from the brainstem and innervated most of pharynx and throat, most of the throat region, most of the muscle region in this area, in the throat area, and neuralgia is is intensive is a sharp and shooting pain along the way of any kind of cranial nerve. So glossopharyngeal is a ninth cranial nerve. Neuralgia is that pain. So glossopharyngeal neuralgia, which means that the intense and the sharp, the intense and sharp shooting pain along the way of the ninth cranial nerve.
All right, sounds good. So what are the treatments for GPN?
So, the main treatment for neuralgia for glossopharyngeal neuralgia right now, I think it's similar to trigeminal neuralgia, is that um, the first line, including anticonvulsions, which is the carbamazepine and oxcarbazepine, and those medications, those medication inhibit the sodium voltage channel, which is it's gonna reduce the neurotransmissions within the nerve. So 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 that is reduce the pain feeling that our brain perceive. So and therefore it's reduce the pain symptoms of the patient. And also the alternative options would be uh, other anticonvulsions such as gabapentin or pregabalin.
So now turning back to COVID-19, you mentioned that there are some other complications, neurologically speaking, related to
Mhm.
COVID-19. Could you detail some of those for us?
Um, are we the all throughout the pandemic, we saw a lot of patients with encephalopathy, which is a problem with the brains and a lot of vascular disease, vascular disease post during and post COVID-19 infections because the SARS-CoV-2 um, um, really at, is really attractive to the nervous system and especially the vascular epithelium. So when it's dragged out, that the blood-brain barrier that can cause a lot of neuropathy symptoms, and we also have a lot of cases that COVID-19 can go Guillain-Barré, which is the which is other peripheral nerve disease.
So in that case, then what is the potential cause or reason behind GPN secondary to COVID-19?
I think it's hard to tell, but from my standpoint, because when I saw the case, I couldn't find any other report about GPN secondary to COVID-19. So, but I found that there are four. There are also other four cases about trigeminal neuralgia, which is the same kind of neuralgia, but happened in the fifth cranial nerve. And that similarity gave me the theory that maybe the COVID-19 caused the inflammation of the nerve, and then when and causes the symptoms, and when the if when that inflammations go away, then the symptoms also won't go away.
Wow, that's fascinating. So you're
Mhm.
one of the first people to report on GPN in relation to COVID-19, huh?
Yeah, but I think I think there'll be a lot of patients that have GPN
Mhm.
secondary to COVID-19,
Mhm.
but but I want to encourage other physicians to report their case too.
Okay, wonderful. So are
Mhm.
there any differences between GPN secondary to COVID-19 and traditional GPN?
Um, I think as I mentioned before, I could not find any case other than our case about the GBM secondary to COVID-19, so I couldn't tell. But but for our patients, all the symptoms are mostly the same. Yeah, but the most important thing when we encounter a patient with GBM is that we have to rule out all the structural lesions like and brain tumor and ego syndrome, which is the styloid process compressing on the ninth cranial nerve. So the MRI will be very crucial, which is now okay. We fortunately have the MRI ordered by the ENT doctor.
Got it. So what work do you have planned for the future in neurology?
So talking about research career, I wouldn't say it's a research career because I'm pretty new in research. For my career, right now I'm gonna interview for a residency training position in the US. And further, I plan for practice medicine in rural areas and for underserved populations. And right now in we living in the digital area, which is we see a lot of applications of artificial intelligence in medicine. So I'm very fascinated about that too. So I'm gonna pursue digital health in medicine as well.
That sounds wonderful. And congratulations on the residency, by the way. That's awesome.
Thank you a lot.
Yeah. So, in the end, I want to ask you two more questions.
Mhm,
First,
sure.
could you tell us any advice you have for emerging physicians or researchers?
So I'm pretty new in research, so I wouldn't tell any. I I think I could not provide an in-depth advice for physicians who want to pursue a research career. But I think the most important feature we should have is the most important characteristic for anyone who wants to do research is curiosity. So so and we should have the enjoyment to share knowledge with other people.
Who has been one of your greatest inspirations along this whole process?
Yeah, so I think it's hard to you have to tell if you have to tell a particular person who inspired me to do the neurology. But I would say the more influential person for my career is Dr. Alaimo, who is also my co-author of the case report, because he is it's so unfortunate that he couldn't be here right now, but he has a very great bedside manner. He has a he always show his curiosity and and also he always willing to share his uncertainty with his students, which is very powerful because I'm not afraid to ask him questions because I share the same uncertainty that he has.
That sounds absolutely wonderful, Dr. Nguyen. Well, thank you so much for joining us today on Curious Conversations. It was a pleasure to speak with you.
Thank you so much, Ria, and it's a pleasure for me to be here, and I'm looking forward to our upcoming conversations as well.
Absolutely. Thank you.